The Roles and Responsibilities of the Registered Nurse by Karen Moore. Where did it all begin? It was only towards the end of the 19th century that nursing was considered a profession rather than a vocation. In fact, during the early 1800s, nursing was a role that was taken on by servants and seen as unseemly, immodest, and certainly not a role for unmarried or well-bred females. Florence Nightingale described nursing of the past to have been undertaken by those who were too old, too weak, too drunken, too dirty, too stupid, or too bad to do anything else. A far cry from the way nurses are seen by the public and professionals today. It was Florence Nightingale who in 1856 became a trailblazer for nurses. She was asked to take a team of nurses to look after British soldiers during the Crimean War. She identified problems and improved conditions dramatically. She lobbied for a system of education for nurses and for nursing to become a respectable profession for women. There have been significant changes in nursing since its conception. This timeline illustrates some of these, including the first training hospital opening in 1860 at St Thomas's Hospital, through to the state-enrolled nurse being officially registered in 1940. So, what is a nurse? According to the World Health Organization, nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups and communities, sick or well and in all settings. It includes the promotion of health, the prevention of illness, the care of the ill, disabled and dying. What do I think when I think of nursing? I think of kind, accountable, person-focused, trust, compassionate, professional, responsible, effective, safe and competent, advocate. Changes in nursing. There have been many changes in nursing and they can be categorised into the following: political, economic, social, technological, organisational, professionalisation and policy. Political changes in nursing. According to the Royal College of Nursing, when talking about their role, most nurses will reference giving physical and psychological care. Rarely the topic of politics will be mentioned. The RCN say that safe, evidence-based, effective care includes being aware of the surroundings of politics and how they impact on the role and responsibility of nurses. Nursing has been affected by decisions since the conception of the NHS in 1946, leading to the introduction of the National Health Service in 1948. There are many political acts that have been implemented that have affected nursing, including the Health and Social Care Act of 2012, which allowed change in the commissioning to include greater involvement of clinicians and increased patient control over their care. This led to nurses becoming more accountable and increased opportunities for them to specialise. And the new long-term plan 2019, the government guarantees investment in community practice mental health services and primary care. For nurses, this means increased specialised and prescribing roles, a greater use of digital technologies. Economic changes in nursing. The NHS is government funded and nursing staff are directly affected by the economic climate. Public spending was slashed after the 2008 financial crisis, causing a massive strain on NHS services and nursing staff. In more recent times, nurses are feeling the pinch of rising costs of living, inflation and ongoing negotiations regarding pay increases. Many of the economic changes have affected nurses, including increased demand on NHS services, technological advances and changes in patient demographics. This affects nurses with a shift in focus to nurses providing preventative health care, nurses being expected to use more advanced technology such as e-prescribing and specialised roles such as frailty to work with the ageing patient demographic. The United Kingdom has an ageing population. The demand on the NHS is ever increasing. People also live much longer with complex health conditions which require hospital treatments and long-term nursing care. Advances in medicine, surgery and technology, we are now able to treat more conditions for longer. This adds to the footfall of service users that require NHS treatment. There are increasing demands on the mental health services. Examples of some of the social changes include increased numbers of mental health patients. There has been a 13% rise globally in mental health conditions since 2017, with a significant number of adolescents and young adults suffering. Suicide is the second leading cause of death in people between the age of 15 and 29. Mental health nursing is an individual role that is studied at degree level. Mental health nurses work specifically with patients with mental health illness. Adults and children's nurses also work with mental health patients and require a broad knowledge, especially of legislation such as the Deprivation of Liberty Safeguards and the Mental Health Capacity Act 2005. Education in nursing has changed dramatically since the first formal school of nursing opened at St Thomas's Hospital in 1860. In the 1900s, hospitals provided their own training schools for nurses. In exchange for education, nurses worked for 2 to 3 years for free. In 1940, the state enrolled nurses officially recognised, and nurses are required to train for 2 years. In 1983, a new professional register is set out, splitting nursing into 4 categories of adults, children's, mental health and learning disability nursing. In 1986, Project 2000 moves nurse training from hospital-based schools to universities and colleges. And in 2009, nursing becomes a 3-year degree-only course. Increased standards in nurse training with opportunities to advance to master's degree level has significantly affected the role and responsibilities of the registered nurse. There are a wider choice of career paths available. New nursing roles. The advancement of nurse education and clinical demands on the NHS has opened up the opportunity for many diverse roles within nursing, allowing nurses to have professional responsibility when providing patient care. This includes emergency care practitioners, nurse prescribers, modern matrons and specialist practitioners. The roles and responsibilities of advanced clinical practitioners: diagnosing and planning care, clinical assessment, acting as substitute for doctors, interpretation of results and prescribing medication. There have been many policy changes in nurses as outlined on this slide, including district nursing, nurses and health visitors being given prescribing rights in 1992, right through to the Royal College of Nursing supporting bringing in prescribing education for newly qualified nurses in 2017. The role of the Nursing and Midwifery Council. The Nursing and Midwifery Council sets and regulates professional standards for nurses, midwives and nursing associates in the United Kingdom. They ensure all nurses are able to deliver safe and effective care with professional pride and public trust. The NMC is responsible for promoting high standards of education, approving and monitoring nursing courses. They set out and regulate professional standards and maintain a register of all registered nurses. They investigate and deal with complaints against professional nurses. This includes assessing nurses' fitness to practice and setting restrictions or removing a nurse's professional registration. According to the NMC, every health professional has a duty of candour. This is to tell patients or their advocates when something has gone wrong, to apologise and offer remedy or support, to explain fully the long and short-term effects of what has happened. Health professionals must be open and honest with their employers, colleagues and with other organisations, and must not stop others from raising concerns. Revalidation. The NMC require registered nurses to confirm their fitness to practice every 3 years by doing the following: 450 practice hours, 35 hours of CPD including 20 hours of participatory learning, 5 pieces of practice-related feedback, 5 written reflective accounts, reflective discussion, health and character declaration, and a professional indemnity arrangement. Confirmation from an appropriate person that these requirements have been met. The code. The code sets out professional standards that all nurses must uphold. Standards are set by the NMC but also reflect expectations from patients and the public. The NMC requires nurses to commit to upholding these standards, and action can be taken against those who do not uphold the code, including allegations of misconduct, bad character, being unfit to practice, and may end with their putting restrictions upon their practice, or being removed from the NMC nursing register. The code requires nurses to be accountable for their actions and work within the limits of their competence. This is a benchmark of excellence that a nurse's work is measured against. The code sets out ethical and professional standards. The 4 P's of the code can be seen by the following slides. Prioritise people, practice effectively, preserve safety, and promote professionalism and trust. Effective communication in the multidisciplinary healthcare setting. Skillful and thoughtful communication is essential in all aspects of healthcare, whether it be between patients and their carers or between members of the wider multidisciplinary team. This allows the shared goal of delivering the best holistic patient care to be realised. Effective communication protects patients, increases operational efficiency, and reduces complaints. Clear, compassionate communication promotes mutual trust between patients and their nurses, as well as increasing the effectiveness of the care providing team. Poor communication can cause barriers between caregivers and their patients and lead to miscommunications between health professionals that can cause the possibility of danger or harm to patients. Communication in healthcare. Listening is important to help identify the needs and reflect on what is being said. It is important that patients feel listened to and that professionals listen to each other. Active listening gives attention and uses paraphrasing to repeat back in the person's own words what they believe has been said. Verbal communication can either be face-to-face or over the telephone. Good verbal communication is a critical skill in healthcare and is used by the multidisciplinary team between professionals and patients, as well as between healthcare workers. Non-verbal communication includes body language such as eye contact, facial expressions, gestures, and personal space. Effective non-verbal communication is crucial when providing care and between healthcare professionals. Written communication is vital and must be clear, legible, informative, and concise. Documentation in patients' notes, prescriptions, and formal letters are all written. Mistakes can lead to misinformation and the possibility of harm to patients. What is the multidisciplinary team? The MDT is a group of healthcare professionals from different roles, such as, and not limited to, social workers, doctors, nurses, physiotherapists, and occupational therapists, who come together to collaborate and make decisions on an individual person's treatment. According to NHS England 2013, the narrative for person-centred coordinated care, co-produced from patients and professionals and written from the service user's point of view, is I can plan my care with people who work together to understand me and my carers, allowing me to control and bring together services to achieve outcomes that are important to me. To be effective, the multidisciplinary team must include the following. Care must be patient-centred. Patients must be included in planning their care. A patient's holistic needs must be considered, and the patient must give informed consent. All members of the MDT must work to the codes of their professional practice. They must work within the limits of their competence, and under Section 13 of the NMC Code, nurses must report to another practitioner if needed. Working towards the same goal, MDTs must work together as a team, sharing information and having an understanding of each other's roles. They must be built on a foundation of trust and mutual respect. They must be led by a coordinator so that the care remains focused and timely. MDTs must meet regularly. Use recognised tools and frameworks to ensure that information is recorded correctly and shared. An example of the positive outcomes of a multidisciplinary approach to healthcare can be seen in Epsom Hospital's home care team. Patients are discharged back into their homes having not quite met their baseline, with ongoing support of daily care in their homes from home care specialists, physiotherapists, nurses and general practitioners. This is an example of primary and secondary care settings working together to avoid and cut down on hospital admissions and long-term hospital stays. According to Epsom Hospital, this has seen a 6% drop in hospital admissions in the over 65s. The integration of these services gives the patients continuity of care and more effective care outcomes, as well as sharing of knowledge and efficient resource management. According to Dr. Hilary Floyd, I am going in, looking at the patient in a much more holistic manner, and it's been a real eye-opener. Multidisciplinary teams also have their limitations. Poor communication, personality clashes, underdeveloped team leadership can affect working relationships. Poor record keeping, lack of information sharing, and changes in team members can lead to a lack of continuity of care. I want to talk about Victoria Clumbier, one of the most recognisable examples of catastrophic failures in multidisciplinary working. Victoria died on the 25th of November 2000 after being admitted to the North Middlesex Hospital on the evening of the 24th of November. She had 128 separate injuries and had been a victim of terrible abuse. According to the Clumbier inquiry, in the space of a few months, Victoria had been transformed from a healthy, lively and happy little girl into a wretched and broken wreck of a human being. A gross failure of all the agencies she was known to, including 2 housing authorities, 4 social services departments, 2 child protection teams, 2 hospitals and a specialist centre managed by the NSPCC. Victoria Clumbier inquiry identified 12 key opportunities that were missed to intervene that could have saved her life. This is one of the most important and horrific examples of widespread organisational failure. In conclusion, the role and responsibilities of the registered nurse have changed a great deal since the introduction of the profession. Patient-centred professional care, regulated by the Nursing and Midwifery Council, will continue to be at the forefront of the profession. The National Health Service is an ever-changing and growing institution that continues to support the nursing role now and in the future.